Hello dear patients, today we are going to review the case of secondary syphilis on a woman's feet. She came to dermatologist with suspicion on fungus or allergy in the area of feet. Externally she used different glucocrticosteroid creams and ointments without a significant effect. There were no rashes on other areas of skin integuments. She came to do analysis for fungus, in her opinion. These rashes were peeling and they appeared about half a year ago. She doesn't remember when exactly. From the patient history it is known that she doesn't have a constant sexual partner. On observation, syphilis was suspected. However, also skin scraping for fungi was also taken. However, it was negative, but complex of reactions for syphilis was positive. Secondary syphilis that this patient had usually appears in 10 weeks to up to 3-5 years, sometimes more. If we talk about this particular case, then it's more likely to be a secondary recurrent syphilis, as the number of rashes is small. They are localized only on feet. On observation, body and mucous membranes were not affected. So on observation on a hard seed, there were no signs of hard chancre or other rashes. So the patient was recommended to have treatment at the place of living. However, she didn't come for a repetitive visit after getting the analysis by email, having done them anonymously in the beginning, when she heard about doctors' suspicions on that disease. Probably such patients walk around Moscow now. The patients often try to treat themselves for such severe diseases as syphilis, which in my opinion is forbidden to do. Unfortunately, this is supported by dermatovenerologic dispensaries, because I had patients who were recommended to inject at home on their own, which was unheard of before. They were recommended to do it not by someone, but by employees of dermatovenerologic dispensaries, by doctors. That's why cases of under-treatment are more frequent now. Seroresistance infection. Many people think that such diseases as syphilis has disappeared. However, there are quite a lot of cases of it in Moscow, and that's not because such patients consult private clinics, but more due to the fact that they do injections on their own, and they read about causes on the internet. They don't do control analysis, etc. This all leads to possibility of repetitive infections, chronization of infection, etc. This possibly happened in this case, as well as the patient said that her mother is a nurse and she can do some injections herself. That's why, of course, during any casual sexual contacts, it's necessary to be checked, to do prophylaxis, including the one after casual sexual contact, if it happened, and contraceptives have to be used. If there was a possibility of infection, if some suspicious symptoms appeared in the area of sexual ones, rashes on the skin, you can consult dermatologists and venerologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of different sexually transmitted infections and skin diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.